Hello everyone, this is Manjri Varde, your host, and today we have with us Dr. Narendranath Meda. He's a consultant vascular and endovascular surgeon at KIMS Hyderabad. Today's talk and discussion is about aortic aneurysm. This is something which most of us are unaware about. Today we need to know the symptoms, the diagnosis, and the different types of treatments that are available for this. Doctor, what exactly is an aortic aneurysm?
Okay. Hi all. An aneurysm is nothing but a bulging or ballooning of the weakened aortic wall in any part of the body. If that bulge or weakening happen in the aorta, the major blood vessel which collects blood from heart towards rest of the blood circulation body, that is called aortic aneurysm. If that wall weakens and it bulges, this is called an aortic aneurysm, which can happen along the aorta. And if this bulges increases size and if it get ruptures, that will cause torrential bleed, internal bleed, which sometimes leads to a death, which needs a medical attention.
Can you tell us what causes it?
The risk of developing aortic aneurysm increases with age, and aortic aneurysm usually affect the people more than 50 years of age, and it's most commonly seen in the men when compared to women. And the other risk factors are smoking and high blood pressures. Sometimes you can see in the patients, those who have got a family history of aortic aneurysm, because the hereditary, there is a risk factor for the aortic aneurysms.
What are the symptoms of aortic aneurysm, doctor?
Yeah, in most cases, patients have no symptoms. However, of those who got symptoms, the most common are abdominal pain, back pain, and sometimes chest pain. And some patients may feel there is a pulsatile mass in the abdomen or throbbing mass in the abdomen. And this most of the times is diagnosed as an incidental finding if someone is getting tests for the other health issues. And the doctor can see the bulge in the abdomen or pulsatile mass in the abdomen, which on clinical examination. And on investigation, it's commonly seen in the CT scan ultrasound. We diagnose it as aortic aneurysm.
So tell me, what are the treatment options that we have today for an aortic aneurysm?
Yeah, when you talk about treatment, there are open surgical approach and endovascular approach with minimally invasive. And in this open approach, the aorta is replaced by making a large cut in the abdomen, and we replace the aneurysmal part of the aorta with the fabric material called as Dacron or PTFE graft, and we'll overshoot to the normal aorta, so that this graft acts as an artificial tube for the blood flow. And it is typically done under a general anesthesia, and this needs 2 to 3 days of ICU stay, followed by a hospital stay for 5 more days, and the patient will take 2 to 3 months for the recovery. When it comes to endovascular approach, we'll call it a minimally invasive approach. With a small injection, we can do this treatment. The aortic aneurysm is treated with a stent graft. It's like a fabric material framed over a metallic stent, so that we use as a replacement of the aortic aneurysm. It will be typically done under as a local anesthesia or sometimes general anesthesia, and the patient needs to stay a few hours in the ICU, followed by 1 or 2 days in the hospital. You can get discharged on the 3rd day or 4th day. And patients usually take 2 to 4 weeks of recovery, which you can go to normal activities within 1 month.
Nice, nice. So, doctor, what are the risks of not treating this aortic aneurysm?
Okay. Among those affected, 20% of them get to diagnose the aneurysm on time. And aortic aneurysm growth has to be monitored. If it's less than 5 centimeters, we'll monitor it every 6 months or yearly once with an ultrasound or CT scan. If it's more than 5 centimeters, it needs to get treated. If we don't treat it, that can cause rupture and it will cause death. The aneurysm may expand and become an exponential size, which leads to death. That's the reason we need to get diagnosed it early, and we need to follow it up if it's not in the stage of treatment.
So, doctor, now I want you to advise everybody who's watching this as to what they ought to do if they detect this.
Okay. If someone has high risk group, example, if someone is elderly, more than 50 years, those who got hypertension, means high blood pressures, and those who already got a smoking habit, they need to get health checkup done regularly. Like we usually say every 6 months or 1 year, people get health checkups. At the same time, they need to get health checkup to look for any aortic aneurysm in their body. Just a basic test is ultrasound scan, which they regularly does in the abdomen. They need to include that to, you should ask your doctor to look for the aorta also. How is my aorta, doctor? Is it bulged up? Is it there any swelling in the aorta? That will help further apart from the routine health checkup. This is where you can prevent the aortic aneurysm. If someone has got a small aneurysm or some dilatation of the aorta, what we have to do is you have to maintain follow-up with the vascular surgeons, where every 6 months to 1 year, we check up with ultrasound scan or a CT scan to prevent it further progression. Or else if someone has got a rapid progression of the aortic aneurysm, then we need to get treated before it gets ruptures. That is what I advise to them.
Thank you. Thank you so much. It has been wonderful creating this awareness, and I'm sure we will all benefit by it. Thank you.
Thank you. Thank you, madam.